So we'll be talking about the antiarrhythmic drugs, and here we're going to basically talk about the different drugs and the classifications of the drugs, and this is sort of like our intro lectures on antiarrhythmics. All right. So when we talk about these drugs, antiarrhythmic drugs, right? There is the scientist called GHA, von William system classification is there. This is the one that we have to discuss about, right? And there's a different classifications of antiarrhythmic drugs. So, that is done by this person right here, the scientist. And we can simply say this is anti, right? And you have arrhythmic, right? Drugs. And what he did was he classified this into different class. So you have a drugs which comes in the headings of, we can simply say, all right? So we can make basically right here. Right, there's a one drug that comes in a classification right here. We call them a class, like a one drugs, right? This is a one group of drugs. And another classifications he did, that would be a class two drugs, right? And there are drugs which comes in the heading of, we can simply say, I will write down here, that would be a class three drugs. And then after that he has another classifications, and that would be a class four drugs, right? So you need to know, so you have to classify these drugs, right, into different four groups, right? And this class one drugs, right, it has even further subgroups, right? This class one drugs, which has a further, let's just say subgroups, like class one drugs, right? And this, this class one drugs, they're divided into further categories. So we can simply say the drugs which comes in the heading of 1A, class 1, this is a 1A drugs, right? This is the one of the heading. And I'm going to talk about what this means. And you have a drugs that comes, and we say class 1, but this B, okay? Look at this. And you also have a drugs that comes in class 1C drugs, right? So class 1 drugs, which are antiarrhythmic drugs, which have a subgroups, which are 1A, 1B, and 1C, right? Now, what are these different drugs? Let's write it down here. And this is very important that you have to know, right? When we talk about the class 1A drugs, right? There are drugs, like three drugs you got to remember. One is called procainamide, right? This is a drugs. It's called procainamide. Second drugs is, you have a drugs like quinidine, all right, this one. And third drugs is something called disoperamide, all right? Please remember these three different drugs. You have a procainamide, you have a quinidine, and you have a disoperamide, all right? Now, we come to list of 1B drugs, right? This is the drugs where we have you have something called lidocaine, all right? And you also have drugs called, something called mexiletine, all right? And sometimes, these guys share similar to it. We call phenytoin, all right? You have also, phenytoin is there. I might have spelling errors, but, we can look it up. So you have a lidocaine, you have mexiletine, and phenytoin. These are the 1B class of drugs. These two, lidocaine and mexiletine, you've got to remember this, right? And we have a 1C drugs. So let me just, divide this, right? You have a 1C drugs also, which are strong than 1A and 1B. There are two drugs which are very important for you to remember. And I'll write down a different color, okay? So 1C drugs here, right here. One is called, right here. It is called flecainide, all right? Flecainide, that's a drug. And second drug is called propafenone. You have a flecainide and you have propafenone. These two drugs belong to 1C group of the class 1 drugs. Now, all the functions of these three drugs, like class 1 drugs, they have a similar functions, okay? what is the function is that this is the main one. So they are different from one another. We'll talk about them in next lectures about it. But this is all these three drugs. One of the actions, what they block sodium channel. All right, they block sodium channels. That's what they do. Now, when it comes about, let's just say this drug or class 2 drug, right? This drug are usually, right? These drugs are beta 1 or beta 2 blockers, all right? And here you have a beta blockers. Like for example, if I write down, you have a drugs that blocks beta 1, only beta 1, then this is where we talk about drugs like metoprolol, right? That one. Or you have drugs like esmolol, or you have acetabutalol, like this. Metoprolol, esmolol, acetabutalol. These are drugs. And there are also drugs which are blocks both beta 1 and beta 2 blockers. Then these are the drugs like, for example, you have propanolol, or you have drugs like a timolol, or you have drugs like notalol. Look at this drug. You have a propanolol, you have timolol, you have a notalol, right? Metoprolol, esmolol, acetabutalol. These drugs are beta 1 blockers. But all these drugs are what? Beta blockers, right? Now, what about the class 3 drugs, right? When we talk about class 3 drugs, these are potassium channel blockers, and we'll just write on the list of these drugs, all right? And this is why we talk about, all right, something called amiodarone. Amiodarone, this is a drug. Other drug is very important, like cetalolol. This is a drug, okay? Third group of drugs which belongs to class 3 is ibutilide, all right? And the fourth is like something called duftilide, all right? Look at this. So these 4, you can sometimes remember this as a AID as AIDS. So AIDS, amiodarone, ibutilide, right? Duftilide and cetalol. This drug, these 4 are what? It belongs to the class 3 of the antiarrhythmic drugs. And then we have a class 4 drugs. These are usually calcium channel blockers right here, this one. And these drugs, I'll just write on 2 drugs, which is called verapamil. This is here right here. It's called diltiazem, right? This is the drug of the class 4 drug. There are 2 of them. You got to remember this. Now, I did this because, I went over these drugs with you because so that you can remember this, right? Now, I'll tell you basic about where these drugs actually works, all right? Because we're going to go very detailed about this. Like this is your heart, right? This is your right atrium right here, right? Left, right ventricle, left atrium, right? This is inferior vena cava, superior vena cava, aorta, pulmonary trunk. Now, we have discussed from your basic physiology, you know that, and I'm going to quickly repeat this too, that, when we talk about the action potentials of the nodal cells, is different, right? The nodal cells is very different from the action potential that happens on the myocytes, the cardiac myocytes. They're very different, right? And that is why we have to go over this graph where, let's just say if I discuss about the action potential that happens on, let's just say the nodal cells, either SN nodals or AV nodal cells, right? What really happens is first, their basically membrane potentials is around negative 60 millivolt, right? And they have something called funny current channel like this, right? And that brings them, because of something voltage gated, calcium channels opens up and then it appears like this, right? Comes to membrane. It appears like this, right? And what is happening here is that this is something called funny current channels opens up right here. And that results into what? This slope, sort of a slope here, right? And this is what we say for phase 4 is, right? Because of the funny current. And that brings us to the threshold, right? This is about negative 40 millivolt. And after that, what happens is there's an L type of calcium channels opens up. So this would be a L type of calcium channels open up, right? And that results in influx of calcium, which is the depolarizations of it, right? And this is what? Phase 0. I'll write down here. This is phase 0. Then after that, voltage gated potassium channels opens up, and this results into what? Repolarized state, right? And this should be what? Phase 3. This is what happens. So you have a phase 0, phase 3, and phase 4, right? This is phase 4. This is what you get to see when it comes about the neural cells, right? Either SN node or AV neural cells. This is how the graph depiction looks like. This is a review, by the way. Now, if we talk about ventricle myocytes or atrial myocytes, right? What happens here, their membrane potentials is about negative 85 millivolts, right? And what happens with this graph is, look, there is a resting membrane potential is this one, resting membrane potentials. And really here, okay, I'll make it a red. What happens is that, a different color actually, there is a, voltage gated, when they trickle, they're voltage gated, sodium channels opens up, right? So that's why we said this guys is what? I with the Na, right? There's a fast Na sodium opens up, and there's a repolarization happens where there's a potassium efflux happening, okay? So this is a potassium efflux happens for a brief period of time. And then after that, what happens is that there is a plateau phase you see, right? And this is where your calcium channels, like for example, your IK, and I'll write down with the ICA, like this, okay? In here, calcium influx happens, I'm putting like arrow like this, and then potassium efflux happens, right? So they're gaining positive charges here because of calcium coming inside, and also losing the potassium because the potassium, more potassium channels keep opening. And that causes, okay, that result into this plateau because there's a numbers of cations coming inside the cells, comparing with the number of potassium leaving the cell that equalizes, right, is because of this becomes plateau, okay, becomes plateau like this. Then as this happening, the potassium channel keep opening, right, and there's a delay, potassium channel opens up, and that causes repolarizations, right, and then it comes to the membrane potentials, again resting membrane potentials, and again depolarization happens, again repolarization happens, plateau happens, and like this. So this is how your ventricle myocytes graph looks like. And there's a different phase happens, right? So this is, we said this is what? This is your phase, resting membrane potential phase 4. This is your phase 0. This is your phase 1. This is your 2. And this is your phase 3. Right? This is what happens. So there are 4 phases that happens in ventricle myocytes or like atrial myocytes. But there are 3 phases that happens in a SN node or AV neural cells. Now this is how the graph looks like. Now, what is the importance of this is that this drugs that we discussed so far, right? They change this, and you need to know this, all right? We need to know this. And usually what happens is that, all this class 1 drugs, right? Look at this, 1A, 1B, 1C. You have a procainamide, quinidine, and disopyramide, right? This works by blocking a sodium channel. But where though? In a ventricle myocytes. Okay, that's where this drugs works. It blocks the fast sodium channel. That's what they do. So as lidocaine, so as maxillotin, so as a phenytoin, that does. So as a flecainide, I think this spelling here, it's a flecainide with a C-A-I-N-I-D-E, and this would be propafenone, right? All these 3 drugs work. It works on here. On the fast sodium channel, it blocks that. That's what it does. That's the main actions. We'll go detail about how they're different, but for now, because this is intro lecture, just know that it blocks the sodium channel, it blocks here. Okay? It blocks here. It blocks this part. It blocks phase 0. That's what these 3 drugs do. Alright? And usually this 1C drugs, right? This is more potent than 1A drugs, and 1A is more potent than 1B drugs. Alright? Now, then after that, let's just say, what about this imidazole and acetalol or ibutilide or dofetilide? Why does this work? These drugs, right? These drugs are potassium channel blocker, which means that it works on the phase 3 right here. That is where this class 3 drugs works. Right? So your class 1 drugs on sodium channel, but class 3 drugs work in phase 3 where they block the potassium channel, they block the potassium outflow, they block the slow delay rectifying potassium channel. That's where this class 3 drugs works. Okay, so I'll write down here phase 3 blocker or potassium blocker or what? Imidazole, acetalol, ibutilide, dofetilide. Now, what about, let's just say, the beta blockers, beta 1 or beta 2, what do they work? Typically beta blockers and then calcium channel blocker. Your class 2 and class 4, verapamil, the class 4 is a verapamil and this diltiazem, they work in this graph. So they work right here. So you see L type of calcium channels? So this is where beta blockers, I'll just write down beta blockers, right? Plus the calcium channel blocker typically works. Blocker. So that means that class 2 and class, let's say, 4 drugs usually work in this graph. Okay? If you're talking about class 1 and class 3 drugs, they work on this graph right here. And they change it. And when we discuss about this, in all this drug, we'll talk about this. All right? Now, before I end this, there's a one concept that I would want to add here, okay? And that is this, that, you know, there is a period when there is, let's say, for example, you know, when the action potential begins here, right? When the action potential begins here, and then when it ends here, and basically it ends when it reaches the resting moment potential, right? So this is where, like, okay, let's just say, for example, you know, there's a threshold potential right here where the action potential begins, and then and when it comes to like basically resting, this whole phase is what is called action potentials, right? Now, this whole from begin, initiates of the depolarization of cell till when it reaches the cells become rest, fully rest, right? When it reaches the resting moment potential, the whole phase, timing that taking this, right? This is what is called action potential. You need to know what that means. You need to know what is action potential means, right? Now, plus, there's another word that you should remember, something called effective refractory period. What does this mean? Or absolute refractory period. It basically means the same thing, okay? Effective refractory period. What does refractory means? It means unresponsive. That's what it means. Now, what is the importance of this? You need to know this, all right? That, what means is this, when there is a, look, when there is a, basically what this graph is showing about depolarizations, right? When one myocyte is going depolarization, let's just say this, when one cell, cardiac myocyte is going depolarizations, right? That means that what is happening? A lot of the sodium, voltage gated sodium channels are opened up, right? That initiates the action potential, correct? When that happens, once it initiates the action potentials, correct? It is gonna generate action potentials, which means the voltage gated sodium channels will keep opening, plus with the opening of what? Potassium channels also, but potassium channel just takes a little more time to open it up, right? And during the time, what really happens is that you cannot generate another action potential, okay? Remember this. Once you initiate the action potential, right? You cannot regenerate action potential until the repolarization state, the repolarization state, I'm repeating this, until it reaches like maybe like half of it or more than half of it. Maybe like at this point, maybe another, if the cell get another stimulus, then they might initiate depolarizations again. But before this point, right, you cannot generate another action potential, right? And that is what this phase is what is called effective or absolute refractory period. The same thing. Effective refractory period and absolute refractory period. You need to know the definitions of this, because when we give drugs like this antiarrhythmic drugs, like 1A or 1C, right? They can actually change this action potentials and absolute refractory period, or they can decrease it, all right? So because of this, make sure you be familiar with this term, all right? That's why I'm going over this. On top of this, let me tell you one more thing. I'm drawing a graph here. All right, again, just repeating this. When this is happening, when let's say ventricle is contracted, this is phase 0, this is phase 0, this is phase 4, 1, 2, and 3, right? Now, when this is happening, right? When this is what is saying fast sodium channels are opening, right? This is basically showing cells is depolarizing, right? Now, if you're looking at this in, let's just say, electrocardiograph, in ECG, how are they going to look? If, let's say, this atria contracts, you know, it makes this little wave like this, right? And then you're followed by isoelectrical line, right? Then when, let's just say, if I quickly make again, I'll just make this as a ventricle right here. This is a ventricle, left ventricle, right ventricle, and this is septum, right? What happens when septal depolarization, it shows, what is this? A little bit of this wave, right? So it's Q. Then when this major ventricular depolarization happens, there's a big R wave, so this, right? Followed by this side. This is what is a base part of the ventricles when they're depolarizing. It's a little wave, like this is wave, right? Now this is called Q. This is P. This is called Q. This is called R and S, right? You know this. And followed by this S wave. And then followed by repolarizations, and this is what? Repolarization state. So that's represented T, right? Now, this is what ECG machine shows, right? Your QRS complex is basically showing depolarization. Now, if they ask you what phase the depolarization state is there, the depolarization is happening here, right? Ventricle contract. That means that this is happening in the QRS complex. So if you give drugs that actually blocks, let's just say that blocks sodium channel, that means that if you give here, then what is going to happen to QRS complex? It is going to either get increased or it's going to get prolonged, right? That is, you need to know that, right? So this is how. So if you block here, this QRS, in ECG, the QRS complex will also be what? It'll be either what? It'll be increased, right? So that will be increase or delay on your QRS complex. You got to remember that. If you increase the QRS complex, what happens? What happens to T waves? The reply that is also get prolonged, right? So there will be. You can simply sometimes there is a but remember, different drugs will do different things. But you might see you might have an increase in what QT intervals also. All right? We'll talk more about this, but I just want you to put this one thing in your mind that, and you need to know this, that when you block a sodium channel, right, what happens to, let's say, QRS complex? It gets prolonged, right? Let's say, for example, if you give drugs that blocks the phase 3, which means that if you block this, that means what happens is that everything is going to delay, right? So you in here in phase 3, what happens? You'll see increase in what? QT intervals, correct? If you give a class 3 antiarrhythmic drugs. So if you give a class 3 antiarrhythmic drug here, what? You see increase in QT intervals. If you give, let's just say, class 1 drugs, you'll see increase in what? QRS complex. And some of the drugs, like for example 1A, you might see increase in QT interval also. Because you're basically blocking here or blocking there. So you must so make sure you correlate this graph with the ECG and what are the changes you see here. And then when the action potential are happening, if the action potentials are happening here, all the way till that, the potassium channel, right, does not reaches all the way to half or maybe even more than a half, then what happens? You cannot regenerate another action potentials. You cannot regenerate. And that is what is called effective refractory period, right? So make sure you know this graph. So the take-home message is this, that, just know this graph, right? Know about this effective refractory period and action potentials, and just have an idea of the class 1 and class 3 drugs works on this graph right here, right? Class 2 and class 4 works on maybe this graph, right? Because class 2 and class 3, especially class 4, there's a calcium channel blocker. So usually it works on this L type of calcium channel blocker. This beta blocker, it can change this, funny current, this guy. And we'll talk about how this graph changes. All right? But this is an intro, and I wanted to, just to give a bigger clue and also list out all the drugs that we'll be studying about it. All right? So, make sure that you know the different classifications of drugs. All right? I hope that I was able to, help you to understand this concept. Thank you.